Hi, this is James here from Headache and Migraine News. Today we're going to think a little bit through one aspect of clinical trials. We see a lot of clinical trials out there in the news, and I would just like us to think through a little bit what those numbers mean that we see, what they may mean, and some things that we need to look for when we are reading about clinical trials or hearing about clinical trials of a new drug. A new drug for migraine or chronic daily headache or cluster or whatever it may be. So, in order to do this, what we're going to do is invent an imaginary drug. So here it is. Jamesinal is our imaginary drug, and we're going to imagine that it's just finished its phase 2 trial, and we've got the results, and they're looking good. So we're going to publish it in all the newspapers and send out a press release, and everybody's going to get all excited, and hopefully when the drug comes out we'll make lots of money. So Jamesinal is our new drug. So let's take a look at what actually we have found in our clinical trials and what those numbers actually mean. Alright, so this blue rectangle represents the world's migraine sufferers. This happens to be a migraine drug, but it would do with any other kind of drug that you might want to think about. So all the world's migraineurs here, and the little line through the middle divides those who this drug may help and those who this drug may not help. So according to our clinical trials, the drug Jamesinal seems to be helping about 50%, we'll say. So anything above the line, all those people above the line are people that are helped by this new drug. So that sounds pretty good. Now, you have to remember, I haven't given you any information on what exactly helped means. A lot of times you'll see a press release and it'll say there was a significant improvement. It was significantly better than a placebo, which means it was a statistically significant percent higher than what a placebo might do for someone. So we don't know if this drug, if it's an abortive, if it'll just work once. We don't know if it's preventative. We don't know if it's got side effects. We don't know if people were pain-free within 2 hours or if they were 50% pain-free within 4 hours. All of that stuff is something to look for when you're reading about a clinical trial, and we'll think more about that in the future here. But for now, we're just going to say that 50% of people in our trial were significantly helped by this drug, and so this is a good thing. Maybe they were migraine-free in 2 hours or whatever. We don't know. But there's a problem with this statistic. It's not quite as good as it sounds. Let's look at the next slide here. Okay. Now, you'll see that we've divided our migraine patients into two. Now, the ones on the left in the blue square, those are people that actually already have a drug that is serving them just fine. So they're already taking something that is working just as well as Jamesinal would work. So it's really the people on the right that need the drug the most, and those are the people that have not yet found anything that is helping with their migraine attacks. So really, the people that will be most helped by this drug are the people in the top right corner now. So we're down to about 25% of migraine sufferers that are really going to be helped by our new migraine drug. Well, don't be sad, because things are going to get a little better here on the next slide. Alright, we forgot about one group here, and that is the group of people that are taking something that is helping them, but it has pretty significant side effects. So they're taking a drug, it's getting rid of their migraine symptoms, but unfortunately it's adding other symptoms that they really would rather do without. So those people are actively looking for another drug because they have something that works, but the side effects are just too much for them, so they would like to try something else. So that's another group that really could benefit from this drug. We're now back up to about 33% of migraine sufferers who could be helped by our new drug, Jamesinal. But things have gotten worse again. Because on the right-hand side, remember we said these were people that had not yet found a treatment that worked for their migraine attacks. Well, I am going to assume that the vast majority of those people will find something, that there is something out there that they will find in the next little while, and they might have to try 5, 10, 20 things. It may take them 5 years or more, but they will find something that will work just fine for their migraine attacks. Something that's already out there. So really, a new drug isn't going to help them. Obviously, it'll help them if it gets a big press release and they happen to hear about it before they hear about the other treatment that would have helped them already. But they're really not the best candidates. The best candidates are the people on the far right in the rectangle that's still red. Those are the people that may try 10, 20 things and still find that there's nothing that works. Now, there may still be something out there that works for them. I don't know if there is something right now that would help everybody or not, but we're going to assume that they try lots and lots of things and there's still nothing, and so they are the ones that are really looking forward to this new drug, probably the most. They haven't found anything that works. We will assume that Jamesinal is a really drastically new drug, something that, not just a variation on an old drug, but something that's really, really different. But now we're really down to about 12% of migraine sufferers that will really benefit. Those people on the far left top and the people on the far right top.